Welcome everyone to our first virtual town hall. Thank you all for joining us this evening. Before we get started, I'd like to take a moment to thank all of our first responders and essential workers, whether you are a healthcare provider, a warehouse worker, a grocery store clerk, or a farm worker, you're making huge sacrifices to help protect our community and keep us safe. I also want to give a shout out to all the teachers and parents out there who are navigating how to implement distance learning. As a father and a teacher for over 34 years, I know that work is not easy. COVID-19 has brought with it a new normal, dramatic changes to our daily lives and routines. These changes were sudden and have understandably left many of us feeling stressed, lonely, and frustrated. However, while we may be physically and socially distanced, we should never be completely apart. Our community is stepping up in new ways to support, connect, and take care of one another. This virtual town hall is meant to be another way that we can connect with each other and provide a platform for some of our local experts to provide up-to-date information and resources related to COVID-19. We hope that this town hall will help answer some of the questions that you might have when it comes to maintaining health during this pandemic. Questions that were sent to us in advance will be addressed throughout this webinar, and any questions that are submitted live in the comments section will be followed up with after the town hall concludes. With us today is Jose Arballo, Senior Public Information Officer at the Riverside County Department of Public Health, Dr. Deborah Dees, Dean of the UCR School of Medicine, Dr. Jerry Maguire, Chair of Psychiatry and Neuroscience at the UCR School of Medicine. Thank you all for joining us this evening. Our first panelist today is Jose Arballo, who will be providing an update on COVID-19 in Riverside County.
So thank you, Jose, for letting me come on today and talk to you. I wanted people to notice I took the mask off. Normally I'd be wearing it because here on the Emergency Operations Center, we wear masks, the face covering every day as part of our protection. As our public health officer, Dr. Cameron Kaiser, has suggested, wearing the mask whenever possible. My update's going to be short because I know there'll be lots of questions, or there are lots of questions. At this point in time, we passed 4,000 confirmed cases today in Riverside County. We also have, sadly, 149 deaths, and that number has risen steadily over the last month or so. On the good side, we have 1,483 folks who were tested positive have since recovered under our system that we have here. And we have 212 people hospitalized, including 78 in ICUs. The response from the county over the last few months started back in January when the plane landed at March Air Reserve Base from China, carrying over nearly 200 passengers. And since then, the response has been not only at March Reserve, but then we moved over to here at the county EOC. We've been responsible for everything from setting up testing centers to working with our hospitals to increase capabilities, also with our nursing homes and assisted living facilities as well. Every one of those areas have been impacted by the COVID-19. So what we're trying to do now is we're moving into a new area. And I know there's a lot of concerns about everything from essential businesses and the governor's order, the stay-home order, everything from masks. When can I go out? When can I start my business again? These are all things that we're working on as a county response. Everybody from the Emergency Operations Center here to those in epidemiology, our disease control people who are doing contact tracing for positive testing, to our administrative staff who's working with the Board of Supervisors And again, as I mentioned, Cameron Kaiser, our public health officer. In the coming days and weeks, it's going to be a very fluid situation. What I'm telling you today could change over the weekend or even next week as the Board of Supervisors come together and make decisions as well. The trend is that the curve we talked about flattening, as you see behind me, has been happening. The testing that has been so important gives us a good view of the depth of the infection in our community. 50,000 people tested is not an insignificant number in a county our size. And per capita, we're one of the highest ranking counties in the state and also nationally. So as we move forward here, and again, as we start to look for easing of restrictions, we're going to continue to make decisions based on what we believe is good, strong public health policy. And also, again, with the reality, though, however, that we do eventually need to get back to work as a full economic engine that can run here in Riverside County. I kind of left it pretty vague because I know we're going to have some questions. So, Jose, that's it for me on a quick update.
Thank you, Jose. Thank you for a very thorough overview of what is going on in Riverside County. So next, I'm very pleased to introduce Dr. Deborah Dees from the UCR School of Medicine, who will discuss the impact of COVID-19 on our community, and especially as it affects people of color. Dr. Dees, thank you for being with us.
Well, thank you so much, Assemblyman Jose Medina. I'm really pleased to be here with you and the esteemed panelists this evening. And I'd like to share a few slides. So what I'd like to do now is share my screen with you. Well, as you can see here from the slide, the Inland Empire is a geographically large and diverse area with over 4.4 million people. And as Mr. Abario said earlier, we have about 4,000 cases, about 1% of the population in the Inland Empire. But the Inland Empire includes not just Riverside, but it includes San Bernardino as well as Imperial County. The other important point about this Inland Empire region is that it's expected to be one of the most 10 populous metro areas in the United States over the next 30 years. However, it is an underserved and under-resourced area as it relates to healthcare and as it relates to providers of healthcare. In the Inland Empire, there are 35 primary care physicians for a population of 100,000 residents. And what is actually needed is about 60 to 80 per 100,000. We're not only short of primary care physicians, but we're also short of medical specialists in various areas. And to top that, many of our physicians, over 40% of them, are physicians who are 55 years or older, which means that those physicians will be retiring in the next 10 years or so. And that just underscores the dearth of the physicians in this area. Riverside and San Bernardino, unfortunately, occupy the bottom quartile as it relates to health outcomes in the areas of diabetes and heart disease, as well as other areas. So when we look at COVID-19's impact on healthcare, I wanted to share this with you because I authored this with many other medical school deans throughout the United States. as well as with our very own from California, the UCSF Dean, Dr. Talmadge King. This was published in USA Today as an op-ed on April 10th this year, 2020. And we as a group stated, we believe the COVID-19 pandemic is radically exacerbating the deadly consequences of racial and socioeconomic disparities in health and healthcare in America, creating a crisis within a crisis. And we say a crisis within a crisis because the extent of healthcare disparities in our nation is already a crisis. So as you can see here, people of ethnic and racial groups are disproportionately impacted by COVID-19 as it relates to death when we look at their numbers in the population. For instance, you can see that in the state of California, Blacks, African American, make up less than 10% of the population. However, when you look at COVID-19 deaths, they make up almost 15% of the deaths. With the Latinx population comprised of almost 45% of the California population, but they comprise of more than 60% of the deaths due to COVID. While we do not have data on the screen about the Native American group, the same reflection is there, that based on their numbers in the population, they are disproportionately represented in deaths from COVID-19. So with the health disparities, it's not that we're just seeing new disparities, but what you're seeing are higher rates of chronic conditions due to long-standing inequities in our country, in America. The lack of access to health care. Many people of color may not have a primary care physician. Some, despite the affordable health care, still lack health insurance. Others have limited access to affordable housing and fresh food. And many of our constituents may live in areas that are considered to be food deserts. There's also an inability for us as people of color to avoid exposure to COVID-19. And I say that because when you look at the essential workers during this pandemic, many of the essential workers are African American and Latinx. And these are the workers that have to show up as essential for healthcare, the transportation. They're the bus drivers, the taxi cab drivers. They work in food service. They work in environmental health in other areas. So there's no way for them to stay at home and say, I'm obeying the stay-at-home order, because it does not apply to essential workers. And then we also have the lack of access to testing and treatment. While there are more testing coming on board, prior to the recent weeks, a lot of the testing was being held in the suburbs and being held in communities that were of non-colored communities. And as a result, people of color may not have readily accessed these tests. So we have to address these health disparities during this COVID-19 pandemic, and we have to address health disparities in general in this country. And part of how we do that during the COVID pandemic is that we need to broadly report and record the demographic data of the virus spread and mortality so that we actually know how populations are disproportionately impacted. And we need to ensure that these populations have access to the current and emergent therapies as well as clinical trials. We should increase and ensure those essential workers, worker protection in their roles. Perhaps providing mobile access testing sites for the vulnerable urban and rural communities. And people in these areas may also need transportation to those sites, or we need to make sure that we move the testing to them. Another way of addressing this is by communicating like we're doing tonight through the virtual communication, but also utilizing local trusted stakeholders and leaders in those communities to get the word out to the people. And we should commit and organize, not just locally, but nationally and regionally, to address the medical and the social determinants of health that have created and sustained the pre-existing COVID-19 health disparities. And when I say those social determinants of health, we're talking about employment, we're talking about housing, we're talking about education, and the list goes on about access to food. So all of these things we need to address. So how are we addressing this at the School of Medicine? The School of Medicine was founded for the purpose of increasing access to healthcare to the people of Inland Empire, especially the underserved, as well as educating a diverse workforce of physicians. And because we want to bring clinical services as well as research services to the people of Inland Empire, the School of Medicine has been at the forefront during the COVID-19 pandemic, and we are responding to this pandemic. One of the ways that we have responded on the clinical side is that we quickly moved a lot of our clinical services to telehealth. Right now, we have almost 80 to 90% of our services in telehealth, and that increases access because people can access telehealth from their cell phones, from their computers. We're in the research area. I know many of you may not know this, but the School of Medicine researchers have already mapped the coronavirus structure to understand treatment options. And one of our investigators have been called on to speak at NIH and to speak through other outlets to share what we have done with mapping of the virus. And our medical students are also on the front line, contributing where they can. When our medical students went to online education, some of our medical students had extra time, and without prompting, they created a mass to deliver to healthcare and other essential workers. They've donated over 30,000 masks to area hospitals, for the essential workers in healthcare, for the environmental services workers, and all of the other workers that are deemed essential. So we're trying to make a difference to fulfill the mission of the School of Medicine. And at this time, I will turn it back to Assemblyman Jose Medina.
Thank you so much, Dr. Dees. And now it's my pleasure to introduce Dr. Jerry Maguire, also from UCR School of Medicine, who will give us an overview of how we can work on maintaining our mental health during these unprecedented times. Dr. Maguire, welcome.
Well, thank you very much, Assembly Member Medina, Dean Dees, Mr. Arbayo as well. I'm going to just share with you a few slides as well, too, and also share with you what it's like to be a clinician dealing with individuals who are struggling during this COVID time. And we know that this is a time which is impacting individuals both physically, but potentially mentally as well, too. I want to share with you some of these thoughts. And how can we stay mentally well during this age of COVID? So just some important reminders about this is all the news out there right now is on physical health and staying healthy. But I'll tell you that our psychiatric illnesses are not isolating. In fact, if anything, they are being exacerbated, unfortunately. Depression is not going on a holiday. Anxiety disorders, schizophrenia, they're not going away. And in some individuals, we're seeing that this COVID is making things worse. The impact sometimes of the isolation is making it hard. I hate to say it as well, too, but many of my patients these days are facing unemployment or underemployment. And that financial stress is adding even more to their depression, their anxiety, their loved one with schizophrenia. And even for those who are fortunate enough to maintain their work, as I am, as others, where we can do this. But for many individuals still, if they're working, they may have work at home. And there are stresses then of balancing this work-life balance. We talk about that importance of work-life balance and maintaining a mentally healthy way. But unfortunately now work and life are together for many folks. They manage their children at the home while same time managing the workload. And how do we strategize that to be able to maintain this work-life balance? One of these strategies that I'm finding is working for many of my patients is to make sure they are being able to separate these duties and have time, if they can, to leave the home, wear the mask and go for a walk or go outside, or get some time that separates that time from the work or the stress of what may be in the family, where they can go out, but also look at it as a positive to say to themselves, well, maybe this is a time where I can focus on the good things of the family and go out for a walk with the family. Make sure that we have those family dinners together every night if they're fortunate still enough to have that. So look to the positives with that, but also focus on that time that you may be in your home all day long, but have a break in the time to say, okay, work is done and now the life begins. Well, there are resources available. Folks know that through our great colleagues here at Riverside University Health System has access as well. They're converting a lot over to telemedicine. But we at UCR Health Psychiatry, we have a fully operational psychiatric program. We're based in downtown Riverside, but now we're available over telemedicine. And I will share with us as well, too, that even though we can access through computer or cell phone, unfortunately, many of my patients don't have Wi-Fi. But fortunately, many of my patients still have the ability where I can call them on the phone. And at least there's that phone, that dial phone or that cell phone. If they don't have a data plan, we can at least talk. And fortunately, our government has been able to relax many of these restrictions that is allowing us to perform telephone and telemedicine visits. There are some disadvantages still. I can't check vital signs as readily, or the one's blood pressure or pulse or physical examinations or other things with it. And as Sam, remember, I want to give out to all of your constituents that as a chair of psychiatry, I'm available to any of them. I want them to see my email address if they're comfortable reaching out to me. This is also our phone number of UCR Health Psychiatry. They want to reach out to us at any time. That's how we can help. But let them know there are resources right here in Riverside to help those people who may not be able to have that access or be able to reach someone. And I'm more than happy to do my part to actually help. And I thank all of our students and others that are out there and are leading this way for us to actually grow. And I'm going to stop sharing my screen here and open back up for the rest of the discussion and the time to take some questions and answers, I believe.
Thank you, Dr. Maguire, for very important information on how to maintain our mental health through this and how to keep work-life balance. And with that, we're going to transition to the question and answer portion of the town hall. We've received great questions from the community that our panelists are going to take turns responding to. Any questions that we are unable to get to this evening, we will follow up with after this event. And as a reminder, panelists will answer questions in a round robin fashion, following the same order that we just had in speaking. Please read the question before answering, and if you would, answer 2 questions per turn. So we will begin with Jose Arpaio. Jose, I think you have questions in front of you.
I do, but I apologize. I don't have them in front of me right now for some reason.
Should we go to Dr. Dees then?
Go right ahead. I'm sorry, I don't have them in front of me.
Dr. Dees?
Sure. Dr. Dees is here. I do have a question. And one question was, is there a link between PM 2.5 air pollution and COVID-19 severity? Well, when I saw that question, I had to consult someone about the PM 2.5 air pollution. And I was fortunate to have within the School of Medicine, one of our faculty members, Dr. David Lowe, who is the director of our Breathe Center. And this Breathe Center studies aerosolized particles, and they're doing work at the Salton Sea, and they're looking at the impact of these aerosolized particles on the health of the people who live in the area. And Dr. Lowe informed me that this PM 2.5 air pollution is basically what they call fine particle pollution. And the fine particle pollution has been previously studied and found to have an impact on respiratory health, on cardiovascular health, as well as other diseases. We also found that there was a peer-reviewed article that came out of the School of Public Health at Harvard recently. And this is just one article. I said it was peer-reviewed. It was non-peer-reviewed, and it was one article. And this article did show that there was an association between the average annual rates of PM 2.5 pollution and the increased death rates of COVID-19. However, with only one article, it's really hard to draw such a strong conclusion that these particles have a direct impact on the death rates related to COVID-19. However, as I said earlier, we know already that the particles do have an impact on health in the area of respiratory diseases and cardiovascular disease.
Thank you, Dr. Dees. If you'd like to take another question as well.
Sure, I have another question. Many of you already know that due to the pandemic, and especially in Riverside County, we were one of the first to go on the stay-at-home order in California. So our public health department was really quick, and they were on point and knew that we needed to go on the stay-at-home order. And we're fortunate for that because we could have more cases. And because we had to go at the stay-at-home order, there's some people who couldn't leave. So the question is, who is still residing in the dorms and housing units, and what services are being provided to them? Now, you know that we have about 23,000 students. And when we had the stay-at-home order, many of the students returned home, and some students did not live close enough and they could not return home. And therefore, we have about 1,800 students that are still on campus. And because they're on campus, we're making sure that they're safe. We are also providing services for them. And these services include student health services. We're providing food services. They're living in 2 dorms, and at those dorms, we are providing dining services. They also get counseling and psychological services, and we have what's called an R pantry where extra food can be provided. But we have a UCR economic crisis response team, and that response team is there to respond to any student who has questions or who has special needs that they need to be provided services in, and that team is on the ground. Not a day goes by without someone checking in on the students and making sure that they're safe, they're healthy, and they're secure.
Thank you, Dr. Dees. Let's go to Dr. Maguire.
Great. Well, thank you so much, Assembly Member. One question we had is, how can one stay mentally healthy during this lockdown time? And just as I said earlier, balancing that work-life balance, getting it, making sure that you're taking care of yourself physically. That means still maintaining exercise, eating the right foods. But I think what's also important to note, and I've seen data on this as well too, that alcohol sales are high during this time. Our dispensaries are still open, everything. So it's important to note not to fall into the trap of substance use. I think that's very important. We know that substances such as alcohol or illicit substances can make one's mental wellness worse. So I think it's important to avoid substances and alcohol during this time to make sure that one doesn't fall into that trap. Keep up their good physical health. And also, if there are issues with the psychiatric illnesses from before, say they've struggled with depression or anxiety, or if it's even being made worse at this time, fortunately, psychiatry and psychology are specialties that we can more easily provide over telemedicine than other specialties. And as Dean Dees was able to say, that close to 100% of our UCR Health medical school visits are over telemedicine. 100% of our psychiatry visits are. So reach out for help, get resources. The resources are there. I'll talk about those a little bit more, but one should go out and get the help if they think they needed it. And if they need an evaluation, we are always there. How do we support the mental health needs of our loved ones? That is making sure that they have access to those resources, seek those out. If they need the help, to get them that right help. And also, how do you support the mental health of loved ones if you're not physically able to be with them? For instance, I have 2 elderly parents. I have not physically been in the same room with them for over 2 months now. They're living with my brother, but they're isolating. But that's what's good about the ability of things like FaceTime or others with that, where we can have those calls, be able to chat, talk about them, and get the families together. Look at these times and say, well, the positives are that no one's traveling, no one's out of town, but let's look at the time to reach out to those loved ones with frequent phone calls and FaceTime chats and others with it.
Jose, I got the questions now.
All right, Mr. Arballo, go ahead, Jose.
Yeah, thank you. Sorry about that. So
No worries.
question one is, what is the timeline for ending the shelter-in-place orders? Well, that's something that actually here in Riverside County and the rest of the county, we're obligated by Governor Newsom's order to stay in place. And I know that people are very anxious about that. What we did is, or we're going to be doing as well, is that the local orders are in place until today for the mask, or I'm sorry, the face covers and the social distancing. But even when those eventually get when they end, we are still going to be under the guidance of the state and Governor Newsom's order. However, by not having them in place, as soon as the governor acts, however he acts, we'll be able to move right into the next stage. And then the other question I had here was, what are the regulations when it comes to wearing masks in Riverside County? Do I have to wear them in public at all times, even on walks or when near other people? So basically what our order is right now is that we ask that you wear the mask as face covers. You cover your nose and your mouth, just like with one of these. And you would do it anytime you leave the house. And however, there are certain exceptions. If you're in the car by yourself or with people that you live with, you don't have to use it when you drive. You're going out for a walk and you're by yourself, and there's not a good chance that you're going to run into anybody. You should have it handy. You don't need to have it on. Biking, if you're going to be doing other things like running for exercise. So yeah, those kind of things we're asking you to wear, not wear them to if you're not required to. However, when you're shopping, when you're grocery shopping, when you're at the doctor's office, when you're going to be interacting with other people, we ask that you wear the face covering, not only to protect yourself from other people, but also to protect them from you. There's the possibility that you're infected and you don't even know it, asymptomatic infection, and you could pass it on to other people. So the hope is by wearing it as much as you can, you're protecting, again, not only yourself, but other people around you.
Thank you, Jose. We'll go back to Dr. Dees.
Okay, this question is, what is the role of UCR in housing health workers during this time? This is a very good question. And this question truly aligns with our mission of the medical school and the mission of UCR, the university itself, because we are part of the community and we want to give support to our community. So I'm pleased to let you know that since April 2nd, UCR has provided 41 rooms for our residents, community doctors, and healthcare workers free of charge at our UCR Extension building. You know, it used to be a hotel, and we kept many of the hotel rooms because we have students who come from other countries that may stay there. And we quickly turned those rooms over to be available to our essential workers who needed them. Now, I want to make clear that these essential workers who are at UCR Extension, they're not infected with COVID-19, neither are they in quarantine. These are essential workers who are working in the hospitals and they're on the front line. However, at their homes, they live with someone that may be elderly or someone who may be immunocompromised. And instead of going home after being in the hospital and being exposed, they want to keep their social distance to protect their families. And they instead stay at the UCR Extension. And this allows them to avoid spreading the virus, even if they got the virus, or it allows them bringing any kind of contamination to their families. And we're really pleased to be able to provide that service to our community. The other question I have is, we had many students from China attending UCR. What has happened to them? Well, not only did we have students from China, we had students from other countries as well. And when we got the stay-at-home order, many of the international students, they either returned home, some of them weren't able to go after the travel limitations and restrictions, I should say. And some of those students are actually living on campus. And others have been given the option to stay in UCR housing. So those students are being well taken care of as well. And they're being provided the services that I mentioned earlier about other students, that cohort of about 1,800 students that are on campus.
Thank you, Dr. Dees. Dr. Maguire?
Yeah, thank you, Assembly members. So question about are there tips, resources, or advice you share that help address feeling lonely at this time? So that is much, which is to reach out. I'm dealing with patients of mine who are feeling this way right now. And some of the suggestions and the guidance that we're giving is, if you have time, please look out. There are plenty of volunteering opportunities to do, or others that can make you feel involved, and being involved with that and helping others during this time can make one feel better, and doesn't necessarily have to mean even involving leaving the home. Still staying in touch with family and friends as much as you can through phone calls or FaceTime chats or others. Those are all great ways to stay in touch and not feel so lonely and isolated. I want to say that even though we have this stay-at-home order, it doesn't mean that you can't continue to converse with others. You might not be able to physically be with them, but use that time to reach out to them and to chat with them. Another question I have is, what sort of resources, particularly free resources, are out there to support mental health? Well, we at UCR Psychiatry, we staff a free clinic every other week in downtown Riverside, in the Riverside Free Clinic. We offer those services. Unfortunately, those are all in-person services, Assembly member, and those have been on hold for a little while until the stay-at-home order is lifted. So looking at other free resources, that's one that I'm hopeful we can maybe get back online to help individuals. But as soon as the stay-at-home order is lifted, the Riverside Free Clinic, and you can check out the Riverside Free Clinic website. My faculty, residents, and our students in psychiatry at UCR, we staff that every other Wednesday night in downtown Riverside. And that's care for those individuals who don't have the insurance or the means to seek out the psychiatric or psychological care.
Thank you, Dr. Maguire. Jose.
Thank you, Jose. The question, does the county have recommended or a list of places to buy personal protective gear such as masks? If so, where can I find the information? There's a lot of people starting to make masks. Well, the one thing we said from the very beginning when public health began recommending people wear the face covers is that you don't need to get a medical grade a mask to use. A bandana, a neck gaiter, other form of coverage, an old shirt. The idea was to provide some cover for the mouth and the nose. We don't make recommendations on where to purchase. We did say, however, that you should keep those types of high quality or medical grade materials for people like doctors and nurses, first responders, where there was a shortage. So at this point, again, there are a lot of people that are making them, a lot of volunteer organizations, again, making it yourself. There is a ton of people showing you YouTube videos on how to do it. And again, most of these that we have are at our offices here were donated too. So we appreciate that. And again, it's the same thing where it doesn't need to be a medical quality. Everything from bandanas. The first week I was here, I used a bandana that I'd had for a long time. So please consider doing that when you start getting your face covered. And then the other one, here's a really good one. At what point can families visit each other home again and start increasing our social circle? And again, that comes back to the governor's order, but I think what Dr. Maguire might have suggested as well. There are so many things you can do to keep that contact with your loved ones, even if you're not there in person, whether it's to Skype, FaceTime, to send text messages or photos to each other. It isn't the same, clearly it isn't. But I think for the time being, those are things that can help you connect again to each other. Write a letter. It's amazing. I've seen people writing letters now, and almost nobody does that now. But the time it takes to write the letter, the physical act of writing can really be something that connects people together.
Dr. Deese?
Yes, I don't have any other questions. So I'll yield to Dr. Maguire.
Thank you.
Great. Well, so remember, we're getting questions about how are the best practices for maintaining mental health during major stressors. And it's not just stay at home, but unfortunately, many of our folks around us are dealing with unemployment, loss of loved ones during this pandemic time. Just let them know that there are resources, there's professional help to assist with that. If for some reason we talked about the free resources, there's resources through Riverside University Health System, through UC Riverside as well, and counseling can help during the grief. I'm hopeful, with this unemployment and the underemployment with my patients, I always remind them of the times where hopefully we could look toward the light at the end of the tunnel. And fortunately, I'm hopeful for a quick recovery on this. But of course, if the grief and the unemployment leads to symptoms where one is having really difficulty with sleeping and energy and mood, then that's especially where we can really intervene. And even at the time, not just talk therapy, but even reaching out to antidepressant medication therapy can be a benefit if it gets that severe with that. Questions as well is that how can we address the mental health impacts of, the continue when we teach our children at home? And that is, again, the stress on the parent having these roles of that work-life balance of not only now that parent being a worker and working at home, but a teacher, and then dealing with all the issues at the home. So that's why I think some of those thoughts about being able to turn off, okay, school is done at this time, work is done at this time. I'm not looking at any more emails from work. I will turn that off, and this is my time to just be alone. Many of us can talk about the times when we have that demarcation of that work-life balance, when to say, I'm done with work, I'm at home, this is done. But now with the stay-at-home order, it's far different. So my suggestion is to have that demarcation, that time to say, okay, I've got to stay physically healthy, I have to exercise, I have to eat right, I'm going to avoid the illicit substances, I'm going to, at most, be careful of the overuse of alcohol and other things. Focus on your physical health, your mental well-being, and others, and to have that demarcation of this school time, it's done, work time done, and now this is family time.
Dr. Maguire, I really want to thank you for that advice, because I think that is really a difficulty that lots of people are having, both as parents, as you said, with their children and their schoolwork, and as working people now working from home. So I thank you very much for that very valuable advice. Jose?
Yes. When we have an option for non-urgent and convenient testing soon, I'm hoping they're talking about just the testing for the virus itself. Right now, we have 4 locations in Riverside County, in Harris and Riverside, Indio, and Lake Elsinore. And right now, you do not have to have symptoms to be tested. So anyone who wants to can be tested. And we had that or the asymptomatic requirement or a guidance since April 16th or 17th. The other thing, and I think Dr. Diaz would appreciate this, we are looking at other traditionally underserved areas like Mecca, the San Jacinto Valley, the Pass area for other locations for testing so that we can get a better idea of some of the areas that may not have that type of access to testing. And these will be walk-in facilities because the ones we have now are drive-in. So we really do want to expand our testing to get, again, that idea of how extensive the virus has infiltrated the community. One of the things that's interesting here is, and it's a question we get a lot, can the public be notified of which establishments have workers that have contracted COVID-19? One of the things that we talk about with many people, either it's employees or members of the public, when a facility or a location has cases, what we do is we tell them that as part of public health, we do what's called contact tracing. And contact tracing is if you have, let's say, an individual with a positive test, that individual, we look into it, we find out who that individual may have had contact with. And we reach out to those people to just let them know that they might be at risk for the illness. And depending on the time that it's taken, sometimes they're put in isolation. They're asked about their symptomology. The reason why we bring this up is because you may not necessarily be impacted by somebody in a building that had COVID-19 or even that works at the same location that you do because you may not be at risk for that. The one thing that happens in these is you get an issue of people being overly concerned about something and that you might have stigma that's attached to it. And then you really have a situation where people are doing things that have no public health value. And so when it comes to notifying others, the public health department, through its contact tracing, contacts those that potentially are impacted. If you're not contacted, we like to say that means we've established that you are not at risk of being a contact person.
Thank you, Jose. I'm going to do one question. It may be the last question. We had several questions on our jails and prisons. So the question that I'm going to take, so I would like to know what the plan is for those detained in Riverside County jails. There seems to be no real COVID-19 response plan to prevent COVID-19 infection in the county jails. Can we release low-level offenders? So I, like many interested people in the community, have looked at and read articles in our local press, in the Press Enterprise, in the Desert Sun, and more recently in the LA Times about the county jail. And we have seen the death of both 2 deputies who worked in our county jails, and then more recently, the death of, I believe, Jose, correct me if I'm wrong, 2 inmates in the Riverside County jails.
Correct.
So I will share that I have been in contact with lots of concerned residents of our community, many concerned organizations as well, nonprofits, religious organizations who have expressed that concern to me. And I have in turn have conversations with our county sheriff, who is under court order now to create a plan. So I would share that we are in conversation with the sheriff and look forward to further conversation with him and that I very strongly believe, as many community members believe, that to be in jail and to be in prison is punishment, and it is punishment enough, and that it should not be a sentence to be further in danger of contacting COVID-19, and that we owe it to them and the larger community to make sure and that we do everything we can so that does not spread within our state prison system or within our county jails. So I thank you for that question or questions, whoever proposed them. I think we may still have a time, Jose, for one more question, if you still have one.
I did have one that came up about how soon would we be able to get back to business, and why does the county seem to not take into account the economic impact on the community. My response to that in general, we've had several of the same questions, have to do with we are sympathetic to the plight of those who have been impacted financially and physically by what's going on. We too have family members and friends and associates that have been impacted by this, and we're trying to move as quickly as we can, knowing that the situation is dire for many people. So we'll continue to work hard for the community, and we hope that pretty soon we can go back to a new normal.
Thank you. We'll take that as the last question. So I again want to thank the panelists, Jose Arballo, Dr. Dees, Dr. Maguire, for providing the constituents of the 61st Assembly District what I think has been very valuable information that they can use. If we did not get a chance to answer your particular question, I know that my staff will be working to get answers to you. And perhaps in closing, want to thank my staff and let the community know that my staff is always ready, like Dr. Dees and Dr. Maguire at the UCR School of Medicine, to be assistants. So thank you all. Thank you to the panelists. Thank you for joining us. Thank you so much for this first town hall.